Welcome to Wednesday's edition of COVID-19. There's been another surge in our daily tally, with new cases standing close to 800, fueled by cluster infections within the Greater Seoul area. Meanwhile, the Delta variant continues to challenge containment efforts, and we have more on that later on in the program. Here first is the broader pandemic coverage with our Kwon Soa. Now, Soa, let's begin here in Korea with that rebound.
Yes, Sunny, we've got a hike by almost 200 infections this Wednesday, as 794 cases were reported as of 12 a.m. And with 759 of those being domestic transmissions, with 35 imported cases, that number being the same from a day ago. So with that, Korea has a total of 156,961 COVID-19 infections, with a death toll at 2,018. Here's a positive development, though. The fatality rate now has dropped to 1.29%. Now, it's nothing new that we are seeing a surge on a Wednesday, but we already had quite a high figure on Monday and Tuesday, so a number close to 800 is a reason for concern. And also, if we compare the figure here, the Wednesday figures this month, we are seeing a clear increase in cases.
Right, and so as I mentioned at the start, the sudden surge is linked to cases here in the Greater Seoul area, which is also raising concerns about the start of our eased social distancing measures, which will come about on Thursday. That is tomorrow. Exactly,
Sunny. So let's take a look at our map first. We are seeing the metropolitan region here, where most cases were concentrated. 375 in the capital, Seoul. That is the highest daily caseload we are seeing this year. And also with cluster infections linked to foreign language teachers, 240 in Gyeonggi-do province, Incheon 30. These are also higher numbers than the day before. And in Daejeon, there's also been a cluster infection linked to a singing room. So 631 of domestic transmissions this Wednesday were cases in the capital region. That's 83.1%. And it's the first time since early January that the number of cases in the capital region have been in the 600s. So the average number of daily cases in the capital region in the past week now stands at 600 and 465, that is. And as Sunny earlier mentioned, we are just about to transition into a revised social distancing system on Thursday, under which the capital region will be under level 2. But now, with these actual hikes in cases, there are concerns that the situation may worsen. So authorities are actually considering this if the numbers are going to rise.
We will swiftly adjust the social distancing level if the outbreak in the capital region worsens to the point where it meets the criteria for a raise. We ask citizens in the metropolitan region, especially the young and middle-aged, to be mindful of precautions so that infections do not spread further.
That age group having been mentioned, as most younger people have not been vaccinated yet. Yoon stressed even if we have a new social distancing scheme, the nature of the coronavirus does not change, calling on citizens to consider the virus situation and voluntarily refrain from eating, drinking, and gathering together in groups, including after-work dinners. Despite the cap on private gatherings of 4 people being relaxed to 6 in the Greater Seoul area for 2 weeks. The official cited a survey on citizens' opinion of the social distancing revision conducted on 1,000 adults earlier this week that showed 11% are willing to convene for such private gatherings, while almost 40% said they would do so past the 2-week transition period, and some 42% said they would rather wait a little more. So with most citizens backing the government's current stance of not letting down guards too fast. And as I said, that because not the majority of the people have been vaccinated yet, but we do have over 116,000 people who have been fully vaccinated yesterday, bringing that total to 4.9 million, with 15.3 million people having received at least 1 dose of vaccination. Meanwhile, Saipan is to become the first travel bubble destination for vaccinated Koreans. So as early as late July, Koreans do not have to go into an isolation period upon arrival. They can make visits 14 days after being fully vaccinated. And last but not least, let's take a look at the global figures now. Driven by the rise in variant cases, there are resurgences in many places. And now India, where the Delta variant first appeared, there's 30.3 million infections with over 45,600 new infections. And also Russia, the UK, as well as Indonesia have been seeing rises due to the Delta variant. Indonesia and India are some places that Sonny is going to connect in a bit. And the total number of COVID-19 cases around the world stands at 182.5 million. Those are the updates I have for now, and I will see you back tomorrow. Back to you, Sonny.
All right, so thank you. See you on Thursday. Right, now for more on Korea's containment efforts amid the spread of variants, I have our Ji Abili here in the studio with me. Welcome, Ji.
Hi, Sunny. So there will be a policy change at the airport to contain the spread of the Delta variant and new ways to verify that you have been vaccinated. But first, let's delve into the details of the COVID-19 rules from next month. Health Minister Kwon Duk-chul presided over a briefing Tuesday and said the infection rate in the Seoul metropolitan area is increasing more rapidly than in the rest of the country.
Following our analysis of the outbreak in the capital region, there have been many incidents of people not following prevention guidelines or not getting tested when symptoms arise due to a sense of complacency that has settled in.
The government has designated the 2 weeks from the first week of July as a special prevention period in the metropolitan area. Local governments will focus their efforts on monitoring crowded venues, places of worship, and amusement parks. Some 8,500 nightlife establishments, singing rooms, and internet cafes will be subject to the stricter guidelines. Cram schools, known as hagwons here in Korea, will also be included. The government will employ a zero-tolerance policy, which means one strike and you're out. Not only that, business sectors and industries where frequent violations are reported will face greater restrictions regarding operation hours and the cap on the number of visitors. For businesses that are deemed to be high risk, for example, call centers and distribution centers, Seoul will provide self-test kits.
Right, self-test kits. Now, also starting in July, G, that would be tomorrow, Thursday, fully vaccinated individuals will not be required to self-isolate upon entering Korea. But I understand this is not the case for everyone.
That is correct. So not if you're arriving from India, Indonesia, Pakistan, and the Philippines, which have been added back on the list of countries where quarantine exemptions don't apply. Travelers from those 4 countries and 17 others will not be allowed to skip the 2-week quarantine, even if they're fully vaccinated. The decision comes on the back of increased concerns over the fast-spreading Delta variant. This is a slight change from Seoul's plan announced earlier this month to allow arrivals from who had been vaccinated abroad to enter Korea without going through self-isolation starting July. The arrivals must be for business, academic, and humanitarian purposes only.
Although we feel deeply remorseful about the people who are subject to these restrictions, we ask for your understanding given the urgency of the situation.
Now, if you're fully vaccinated and arriving from countries not on the mandatory quarantine list, for example, the US, you just need to take 3 PCR tests, once prior to departure, 1 a day after the arrival, and 1 more within 6 to 7 days of being in the country.
I see. Now, before you go, Ji, do tell us a bit more about the vaccine verifications that will be issued by authorities here.
Sure. So come July, you can get your proof of vaccinations on and offline. Let's hear more from a top Korean health official.
You can receive your vaccine certificate from the location where you got your shot, whether it be vaccination centers, hospitals, or community health centers. You can also print them out for free from either the KDCA or the e-government website.
There are 3 ways that you can prove you have been vaccinated: a hard and a soft copy certificate and a sticker. An A4 size paper certificate will contain the who, what, when, and where of the inoculations, as well as the number of the shots. It can also be printed out in English to make it convenient for using it abroad. If you want a soft copy, you can install the KDCA COOV app on your mobile. After authentication, you can download a digital certificate containing the same information as a paper one. It also comes with a QR code. But there is one difference. The digital version is only available in Korean for now. It will become available in English sometime next month and will gradually be provided in 14 more languages. Last but not least, community centers will also provide stickers that you can attach to your resident ID cards or driver's licenses. It will contain the basic information like your name, the number and date of the vaccinations. And that's all from me today.
All right, as always, thank you very much for the coverage.
Pleasure to be here.
Right, on the international front, Indonesia is reportedly on the brink of a coronavirus catastrophe amid the rampant spread of the Delta variant. For more on the situation there, I have George Arif live on the line. Welcome, George.
Hi.
Now, George, Indonesia has been recording some 20,000 new infections on a daily basis in recent days. How severe is the situation there, and how are authorities explaining this frightening resurgence?
Yeah, right now the rate in Indonesia is quite high. The reason for the spike was Indonesia's location that is quite near to India, and the country were visited by Indian citizens having the Delta virus variant. So the variant here is here already, and we are strongly advised to stay home. And for those who need to go out, are advised to wear double masks to shield against the airborne virus variant. One of the cause of this spike, the other thing is culturally related. During the Ramadan feast, it is a culture here for people working in big cities to go back home to their families in rural areas, thus causing people to travel between places. The government and the authorities are strongly advising this not to happen, as well as enforcing road closure for people for traveling during the time. But since it is a cultural thing, the people is quite hard in obeying this. I do think that in Asia, some of the hindrance of handling this pandemic are culturally related, like bathing in Ganga River in India and having Songkran festive in Thailand. As well as in Indonesia, we have Ramadan. That's what's the causes.
I see. Now, George, aside from being asked to stay at home and to wear 2 masks when outdoors, what other measures are in place to contain this latest outbreak?
Yeah, basically our government is handling this very, very seriously. President Joko Widodo and the Indonesian Ministry of Health is providing vaccination for free for everyone, for every Indonesian citizen, as well as foreigner residing here for holding proper documents, so for instance, work visa and so on. This also applies for Korean citizens working here. So this doesn't only happen by the government effort only, but also community initiatives are organizing vaccination for public, like high school alumni, universities, hand in hand collaborating with government officials and media. And moreover, the school is on holiday now. And the past year, the students were attending online school in order to seize the pandemic. The government also enforces strict measures about physical distancing, limiting the use of public areas, no entrance for public parks and shopping malls with limitation. In Jakarta, we wear masks and practice health protocol while doing our activity. Before the pandemic, we have a regulation to limit the use of privately owned vehicle. But now we do not have the regulation, so people can use their privately owned in order to use to minimize the use of public transport.
I see. Meanwhile, on the vaccination front, you mentioned the president. Now, Indonesian President Joko Widodo has called on authorities to boost the rollout to 2 million shots a day by August from the current 1 million. How feasible, George, is this plan?
Yeah, that is correct. We are aiming high because we need to achieve more on the widespread vaccination. The vaccination is happening everywhere simultaneously in big cities. As the main spreading point are the big cities, most Indonesians have received Sinovac and AstraZeneca vaccines. We have Bio Farma. Bio Farma is a state-owned enterprise. Bio Farma is manufacturing the Sinovac vaccines as well as developing the digital infrastructure for administering and tracking the vaccines for wider recipients. On the recovery side, many health workers are working tirelessly in hospitals handling COVID-19 patients.
Right, and George, talking about healthcare workers, almost 1,000 of them have lost their lives to COVID-19 since the start of the pandemic there, including 400 doctors, about 20 of whom were fully vaccinated. What more can you tell us about this?
Yeah, it is quite sad for everyone here because some of my friends also are doctors, right? So recently we lost more lives of doctors and health workers. In December, it was 57 people. In January, it gets higher to 66, 67 workers and decline in February. But now, this month, the rate goes going up again. It goes skyrocketed. But the vaccination received by the doctors actually lowered the rate of death among doctors. While maintaining strict health protocol, I think, and quoting the health authorities here, the reason of this spike is due to the Delta variant because it is very easily widespread. It's airborne, and the COVID-19 patient with Delta variant tend to transmit the disease quicker and more ferocious to the health workers here.
I see, which is why I believe authorities there have granted the green light for Sinovac vaccines for children aged between 12 and 17. Tell us a bit more about this, George.
Exactly. The next group planned by the government is the 12 to 17 years old, the youngsters. So we do hope that this will go smoothly, as this also will accelerate the decision on having the face-to-face school program, because it's been 1 year and everyone is really missing their school. So we do hope it's going to lay down very soon.
Right. We'll keep our fingers crossed for that. Now, George, plans to reopen Bali, though, have been delayed in light of the recent rebound. What is the latest on that front?
Yeah, exactly. As what also happening in other countries, the travel industry is the one that gets hit pretty bad. Also in Bali, everyone is doing nothing now because the most of thing doing there is the travel things. So since the pandemic started, the government is giving support funds for small to medium-sized hotel and restaurant everywhere in Indonesia, not only in Bali, in order to sustain the people's economy. So they want to support the SME hotel owners. It's been done, and the government is also planning to do the Work from Bali program. It is a program where government officials will be assigned to work in Bali in order to support the Bali travel and tourism. This may expand to other programs in other destination areas. Let's say work in Manado, work in other places. This support are directed towards the domestic market. So basically, the government trying to escalate the travel industry again by focusing on the domestic market, while people and the travel workers are enforced to practice the health protocol.
I see. All right, George, as always, thank you very much for making the time to join us live at this hour with your thoughts.
Yeah, I hope we will get through this, well-mannered, and I wish the same there for you.
Thank you, George. Right then, back here in Korea, quite a number of the self-employed are coming up with innovative initiatives to stay afloat amid the prolonged pandemic. We have details in this next report.
Self-employed people are increasingly facing a severe debt crisis amid economic distress caused by the COVID-19 pandemic. In fact, 9 out of 10 self-employed people reported that their sales have decreased by more than half since the pandemic broke out. As of the end of 2020, the self-employed loan balance increased by about $104.5 billion from the previous year.
Almost all industries have been negatively affected by the COVID-19 pandemic, and singing rooms are the ones that have been the hardest hit, as over 2,000 singing rooms were closed last year alone because of the government's administrative order. And I am at a singing room where it began providing a new service for its own survival. Let's get inside and find out more about it.
A coin-operated singing room near a university recently launched a new service. At here, people can use the booth for studying or working, as all rooms are soundproof. When you need, you can always bring a desk. Also, it has a power socket, which you can charge your laptop or smartphone, And when you get bored, you can sing it anytime, as much as you want.
So starting January this year, this singing room has turned into a place where you can not only sing but also study. All these services are available from 11 a.m. to 6 p.m. as long as you pay $9. The owner said he decided to utilize this place to alleviate economic hardship.
All visitors are required to strictly follow all quarantine rules. The biggest advantage that visitors can have here is that they can use a singing booth without contacting someone.
So I've got my lunchbox delivered. As you can see, it's a legit meal. However, this is not from a restaurant, but rather from an internet cafe.
Looks delicious, but it's not cooked at a restaurant, but at an internet cafe. Just like singing rooms, internet cafes have been classified as high-risk facilities. With that, the gaming cafe market suffered huge economic difficulties. Eating food inside PC rooms was temporarily banned during the intensified social distancing measures, though. Now you can have light snacks or meals again. However, as sales dropped sharply due to the prolonged pandemic, internet cafes began food delivery service. As long as business is registered additionally, there is no legal issue.
매출은 배달이 자리 잡고 나서 지금 PC방 원래 제 주업이었던 PC방보다 비율적으로는 6대4 이 정도 매상을 유지하고 있어요.
Sales coming from PC rooms dropped. However, thanks to the growing number of food delivery orders, the overall sales rather increased.
PC방에서 이제 와서 먹는 것도 좋은데 집에서도 PC방 거 그대로 먹던 음식 먹으면 좋으니까 저도 많이 시켜 먹을 것 같아요.
코로나라고 하는 것이 사람의 이동을 막은 겁니다. 공급도 막고 사람 이동도 막고 수요도 막았기 때문에 노래방에서 커피를 판다든지 낮잠을 잘 수 있게 숙소를 제공한다든지 이와 같이 본인의 고유의 업종이 아니라 부가적인 업종으로서 생존을 했다 이렇게 말할 수 있는 겁니다. 코로나의 시대가 만들어낸 새로운 시대의 풍경이었다 이렇게 말할 수 있습니다.
Other than coming up with a new service, self-employed people are trying so hard, even at this moment, to reduce the COVID-19 impact by sharing store spaces or by having a second or a third job. This has been 신새벽.
The ECDC is telling us that 70% of the new infections are projected to be due to this variant in Europe by early August.
I said this was the scariest time that I felt since the pandemic started, and that's proven to be the case.
세계에서 백신 접종이 가장 빠른 나라도 방역 모금 국가도 한순간의 방심과 변이 바이러스 때문에 다시 방역의 고삐를 조여야 하는 상황입니다.
In today's session, we bring you a broader look at the global spread of the Delta variant and ongoing vaccination efforts to better contain it. Now, here in the studio, I have Dr. David Kwok from Soonchunhyang University Hospital. Good to see you again, Dr. Kwok.
Good afternoon.
And joining the session virtually is Professor Rajiv Dasgupta at Jawaharlal Nehru University in India. Pleasure to have you with us, Professor Dasgupta.
Hello, good morning from New Delhi.
Right, and also live on the line is Professor Ronit Calderon Margalit at Hebrew University in Israel. Pleasure to have you with us, Professor Calderon Margalit.
Thank you for having me.
Right, then we'll start here in the studio. Dr. Kwok, our daily tally has surged to almost 800 today. What are your thoughts on our current COVID-19 situation, including the spread of the Delta variant here?
I think this was rather expected that the number was going to rise back up because we were rather becoming once again complacent with all the social distancing guidelines, and we're also coincidentally going into vacation period during the summer. So a lot of the people, especially the youngsters, were gathering a lot more socially and also going to places that where they would be exposed to transmissible viruses. But also in regards to the Delta variant, I once said before that it is inevitable that it'll take over all the other variants of the virus in our country eventually. I think it's only the beginning of it. And sadly, we also noticed that there was a case domestically that happened with Delta variant. So I think in near future, we are likely to see many more numbers of Delta variants coming up in domestic cases as well.
Right. Now, over in Israel, Professor Calderon Margalit, following a remarkable vaccination campaign, authorities there lifted their indoor mask mandate, only to reimpose it days later amid a resurgence. Could you tell us a bit about the situation in Israel?
Yeah, so Israel really is one of the leading countries in respect of the vaccination rate. We reached almost 89% of those who are 50 years and above. And overall in the adult population, it was over 80%. So, and we really saw this huge decline in cases, hospitalizations, no deaths for quite a while. And then the mask indoors mandate was taken off. And also we had much more traveling from abroad. And this kind of enabled, I think, the spread of the virus, not in huge numbers and mostly in educational settings. So part of the recognition of the cases is because we have a good sampling in schools, which we don't have so much in the community. I mean, it's much better in schools. Once you have one kid that is positive, then they kind of sample the whole school. So now the masks indoor mandate has returned, and there are talks whether we should return also what we used to have, the green badge or the green passport, where you would enable only vaccinated people to gather indoors.
I see. Meanwhile, over in India, Professor Gupta, some are claiming the worst is over in India, while others believe the crisis is now being downplayed. What are your thoughts?
No, the crisis is certainly not being downplayed, because at the peak of the crisis, media, civil society, all these certainly reflected the true picture and the anxieties that went with it. So it's certainly not being underplayed at this moment. In fact, now for 3 weeks plus, the positivity rate has remained below 5. It's currently ranging between 2 to 2.5. However, there is still nearly 24 districts which certainly account for a very high proportion of the new cases currently. But yes, as it seems, the very ferocious second wave, which was led both by the Delta variant as well as by the Alpha variant in some parts of the country, certainly seems to have ebbed.
I see. Professor Gupta, I believe authorities there are also closely monitoring another variant called the Delta Plus. What can you share with us about this new finding?
The Delta Plus variant has now been identified in about 12 states, a total of 51 cases. To the best of my knowledge, there's been a few deaths, but most of them are very elderly with other comorbidities. Information on Delta Plus variant is still unraveling. It's certainly being closely watched, but we certainly don't know yet whether it's more transmissible or whether it's more lethal.
I see. Meanwhile, Dr. Kwak, are chances of virus mutations greater in places that are battling higher numbers of transmission?
Yes, well, it's a scientifically proven fact that more the transmission, more the possibilities for the virus to mutate itself. It also stands with longer stays in a person. So when there's a person who is immunely weakened, that the virus is not completely eradicated and has to stay for a much longer period of time, and then it transmits to somebody else, there's also a greater chance that that virus might be mutated multiples of more times when it is transmitted to other people. So in cases of countries that are rather being uncontrolled of the daily case numbers, there is a chance that still a new variant may come up from there. As you've seen in the past that with the Brazilian mutation, but also South African mutation, as well as the UK mutation, it was always the case where a lot the transmission of the virus is happening much more than the other countries. I think the fact, it reiterates the fact that for those countries who are kind of battling to contain the numbers down, we need global effort to help these countries also minimize the daily tolls, and also to have them vaccinated as much as the developed countries, so that in overall the result will be the global benefit from us being rather more safer than to be expected from mutations again happening in these countries.
Right. And staying with vaccination, Professor Calderon Margalit, based on the situation in Israel, what can you tell us about the protection offered by the Pfizer vaccine against the Delta variant?
So apparently what we see is still that most of those who were confirmed are unvaccinated, most of course the children that were confirmed, and they account for quite a large proportion. And also among those who were vaccinated and were confirmed cases, there are no hospitalizations so far, and no severe cases. So I hope it stays this way. It's still too early to really tell because the numbers are still very low. I hope it will be always low. It will keep this way, but I assume that we will have some kind of a spread in the community, and it all started like 2 weeks ago, so we don't have really kind of no perspective to judge. So far, it seems that the vaccines are very effective against severe cases.
I see. Dr. Kwak, some research shows a stronger immune response in the case of cross-inoculation with an AstraZeneca dose first, followed by a second Pfizer dose. Do you suppose cross-inoculation may offer perhaps a stronger protection against the Delta variant?
I would personally take a wild guess that it actually would. Because as we've seen from multiples of different studies, the viral vector type of vaccines tends to show a rather lower efficacy compared to the mRNA types. But when they in fact are mixed and matched to, let's say, contain all the antibodies that are possible from either side of the vaccine, my theoretical approach is that it would be able to cover more variety of different morphological antibodies, meaning it would be able to cover a bigger area of antibodies. So my guess is that if we start mixing and matching, once the safety issue is cleared, I think it'll be able to also fight very well against the Delta variant, and that is my current hope.
Right. Dr. Kwak, there's also talk over in the US about the need for a second shot with an mRNA vaccine for those who received the single-dose Janssen vaccine. What are your thoughts on this?
So to my knowledge, it's primarily claimed because with other studies that have shown people who received only one vaccines showed a much less efficacy against not just Delta variant of the virus, but also Alpha variants and other variants of the viruses. Namely, the Pfizer apparently showed about 33% when they inoculated only once to people, and then with completion of the shots, they were able to improve that up to 88%. So there's a huge jump between one shot and two shots. And again, a very basic approach to this is Johnson & Johnson Janssen is providing only one shot, and that's the completion of it. Makes a lot of us think that maybe it also needs a booster shot as if done with other types of mRNA vaccines as well as viral vector types of vaccines. But I believe Johnson & Johnson Janssen also is currently studying their exact efficacy against specific Delta variants. So we have no knowledge of that yet. It'll depend on how strong the Janssen can provide protection against Delta variant, whether or not the global governments should decide to inoculate people with further booster shots as well.
Right, and staying with inoculation efforts, Professor Dasgupta, on a bright note, I understand that public vaccination has been picking up rapid pace over in India. Could you tell us a bit about this?
Oh yes, after a lull in May, June has certainly been a month of splendid performance as far as vaccinations go. There are still a couple of concerns that we may flag, but first the good story. The good story is that at least 60% plus of both 45 plus age group and the 60 plus age group have now been vaccinated with at least a single dose. However, in both these groups, the second dose seems to be stagnating. It's not picking up at the rate at which cumulative first dose figures would suggest. Second, and that's perhaps a little more worrisome, the second dose in healthcare and frontline workers also has stagnated a bit. If you see the contrast with the relatively high proportion of first dose immunizations in these groups. So these are areas we need to focus on, even though the overall performance, at least with a single, with one dose, is good. The real demand now and the challenge now is to immunize very large numbers of 18 to 44 age group, which is the young population, the working population, the student population. The supply situation now is a lot better than it was a month ago. And one last point in terms of inequities within. In the month of May, when there was a real crunch, rural vaccinations really stagnated. But again, that seems to be changing fast in this month. So at the end of June, I think we are a more comfortable picture than we were a month ago.
I see. Professor Dasgupta, are authorities in India seeking to perhaps do more to boost public participation in the country's vaccination efforts?
Yes, of course. A whole lot of social mobilization activities, a whole range of communication strategies are underway. But the issues I flagged, the groups where it's still lagging, those perhaps require a bit more focused communication targeting than at present. At present, still, it's a little general and not really tailored to where the gaps are.
I see. Meanwhile, Professor Calderon Margalit, if the vaccination process in Israel also is actively partaken in by the children there, the younger children, of course, do you suppose Israel can rely on herd immunity to fight variants like the Delta variant?
Well, so what we are seeing now is our efforts to vaccinate those who are 12 to 15 years old. There was a kind of, I think, resistance for vaccinating children, and in a way, I was also part of that, a hesitation to vaccinate the kids because of the reports that we had in Israel of myocarditis. But now it seems when the cases are surging, it seems that we are going to vaccinate all these children, and that this hesitancy has disappeared. Nevertheless, it will be very difficult to reach herd immunity, because if the R0 or not is really higher than we expected with the Delta variant. So if we are talking about something that is about 5 or 6, or we don't know the exact numbers, but depending what are the estimations, and we have such a young population in Israel, it will be very difficult to reach herd immunity with such a high proportion of children amongst us. And nevertheless, I think it depends also what is our target goal, whether we want only to suppress the number of cases or whether we want to control the severe cases. So I think in terms of severe cases, we are already in a good position. And if things continue this way, it might be under control. If we want to control the spread of disease in the community, for example, to try and really limit the possibility that we have new variants or that the new variants don't take hold in the community, then I don't see how we can get to herd immunity with not having all children vaccinated.
I see. Dr. Kwak, recent infection patterns here in Korea show a growing number of young unvaccinated adults exposed to the virus. Now, I suppose the rampant spread of the Delta variant is only inevitable among these young people, given their active participation in society.
Well, let's not forget we still haven't vaccinated rather older generations either yet. Our coverage of population who were inoculated so far is far beyond countries like Israel and the United States. We have barely completed shots for less than 10% of the population, and we're reaching about 30% of the population who received their first shot only. And let's remind ourselves the Delta variant is still very ferocious in people who has only received one shot, let alone who are unvaccinated yet. So we cannot really solely pick on the young generations who are either around 30s or less, because there are other people in their 40s and 50s who still hasn't been vaccinated. So we really have to cover all these people in the shortest amount of time possible. We still need to get our hands and secure these vaccine dosages so we can cover more portion of the people. But also, obviously, as you said, just coincidentally, over the last weekend, I had a chance to pass by Gangnam area where a lot of these youngsters gather. And I saw huge lines behind all these bars and restaurants heading towards about 9 p.m.-ish. It's not a good sign. It really shows us that how complacent we have become and how we really need to remind ourselves social distancing is probably the most basic and most crucial protective method that we can keep to ourselves next to the vaccination. So until we get ourselves the vaccination, we really need to keep social distancing guidelines, not just among the younger generation, but for all the generations that are exposed to the virus.
Of course. Moving elsewhere, Professor Dasgupta, there are concerns that the Delta variant could trigger catastrophic consequences in Africa, which falls far behind the global vaccination drive. Do you share these concerns?
Yes, of course. Africa and indeed much of the world is facing the Delta variant challenge, which, as I said, was faced by India in its second wave. I think a particular case in point is the Gov'T province in South Africa, which, though a small province, accounts for at least 20 to 25% of the population. After being severely hit by the earlier wave caused by the South African variant, it's now facing a huge deluge of cases due to the Delta variant. But the final point here is, as South African experts point out, that because the AstraZeneca vaccine wasn't effective at that point, South Africa actually did not go by the WHO advisory on that matter, that it will indeed prevent the severe cases and cut down mortality in the earlier wave caused by the beta variant. And therefore, by rejecting the AstraZeneca vaccine, South Africa, in fact, sort of fell back on the vaccination campaign and the vaccination coverage. And therefore, now that there is indeed evidence of the Delta variant also being protected reasonably by the AstraZeneca vaccine, which certainly remains one of the major workhorses across the world, and certainly in India, where 90% is AstraZeneca, South Africa is probably having a rethink on how wise that decision was. So, and that could hold for other countries of Africa, and particularly the more populous regions as well.
Right, that is true. Professor Calderon Margalit, what do you believe that is next on the pandemic agenda in Israel in the face of variants?
Well, so first of all, it's really increasing the rate of vaccines also in teenagers. And then we have to see whether we have to increase the social gathering limitations. So one thing that we have to do and already started to do is have a better control on the influx of people to Israel, because the control and the testing of people entering the country wasn't so good. And I think that has improved recently. And then the question whether we'll have the green badge. I don't see anywhere soon that we'll have to have anything that is much stricter. No, I don't believe that we'll have any more lockdowns. Certainly hope we won't. Another thing that we have to take care of course, is also the vaccinations for the Palestinians who are our neighbors, and we have to promote that as well. So basically, I think we are in a very good situation. I mean, we have this increase in cases, but it's nothing that you would say that should really severely interfere with our daily life.
Right. And here in Korea then, Dr. Kwak, what other measures do you propose to better respond to the spread of variants here on the local front?
Obviously, it's the social distancing guidelines. So we have to really keep ourselves really careful not to expose ourselves. That means we have to keep the social distancing, physical distance between people and keep wearing the mask. But I just want to make one point here before I end the conversation. There are other methods that are also coming up to cure possibly the virus. And maybe our government can also start seeking other methods of protection aside from vaccination and get our hands in advance to other relative genre and area so that we have different options to fight against the virus as well.
Like on the therapeutic front then?
Yes.
All right, Dr. Kwak, thank you very much for your thoughts. And Professor Das Gupta over in India, thank you very much for being with us today. And Professor Calderon Margalita over in Israel, thank you for your time as well.
Thank you. Thank you so much.
Right now, vaccines are among the few of our tangible options against the pandemic, especially in light of the threat of variants. Now, this is according to most medical experts, including those who joined us today. So do seek to get yours when your time comes around. Thank you for watching.